Okay, well, good morning once again, everybody. Welcome to today's webinar on September 2nd. It's hard to believe again that September 2015 is here, but it definitely is. And we had a really hot summer in Marin County, California, very unusually hot. The last couple of summers, I never even put on a short sleeve shirt once. But this summer was like that all summer, so I hope that's not a permanent trend. And then I was down in Phoenix for 10 days, my old stomping ground, making some big changes with the East-West Med office, which you'll probably get an email about soon, new order procedures and so on. And it reminded me why I left Phoenix. 110 degrees all the time and blasting air conditioning all the time. So good to be back up here. So anyway, today's webinar is something which, for anybody who's been on lots of my webinars or seminars, this will be fairly introductory to you about pain mastery sequence therapy. But even if you're very experienced, I guarantee you'll get at least a few things that you probably didn't quite get correctly before. That always happens, no matter how many times you've studied this stuff. There's always some new gems of information and aha moments. And for anyone who's new, like Catherine, this will be a great presentation to learn about the Acutron and some of these advanced methods that we've developed for microcurrent therapy. So welcome, everybody. We're going to get started now. So anyway, here's a picture of me, fairly recent one. Actually, I've had another photo shoot since then. And I live here in Tiburon, California. I'm a licensed acupuncturist. I'm also doing fifth dimensional healing and other types of higher dimensional healing and integrating it with acupuncture. Yes, inventor, writer, trot all over the world, and president of East-West Seminars and now the Microlight Institute. I do welcome anyone here to write to me at dstarwynn@eastwestmed.com. So as I mentioned last summer, East-West Seminars is not putting on any more live seminars for the rest of this year. But I was invited to teach at the Microcurrent Case Conference, which is a yearly event that takes place in different parts. Last year it was in Florida. This year it's actually back in Arizona in Carefree, which is just a little bit north of Scottsdale, or Phoenix, and a beautiful resort there. And this is a really unique event. The Case Conference is something that's happened. This is the 9th annual. This is the 9th year it's happened, where people from many different professions, there's chiropractors there's MDs, there's acupuncturists, there's various types of holistic healers, using many different types of microcurrent devices, different FSM devices, and Acutron, Pantheon, and Inspirastar, different ones like this. And people come together. It's like a cross-cultural type of gathering where people share cases from their practice, like cases from specific patients that really illustrate a new technique or a new way of treating where they had a great breakthrough result. So it's days of people just presenting their most valuable clinical cases and knowledge to each other. And then in addition to that, there's actual classes. Now, I'm personally teaching a 2-day workshop there on the 7th and 8th of October. That's actually a Wednesday and Thursday, a pre-conference 2-day seminar. And I'm also giving at least an hour talk during the conference and presenting a case. If you come, you can present a case from your practice too. So it's really a fun event, very inspiring. You get all kinds of ideas from so many people who are really advanced practitioners. So if you want to learn about this, you can go to www.eastwestseminars.com and click on the upcoming events, and you will see this listed. What it tells about my class that I'm teaching there, and then if you click on the link there, it'll take you to the website for the case conference, which again is not part of my business. I'm just a presenter there, and you can learn all about it. And they have an early registration discount till September 7th. So if you're looking for a good educational opportunity and really build up your microcurrent skills, this would be a great thing to do. Highly recommend it. And here are the upcoming webinars for this month. And now the webinars are all through the auspices of Microlight Institute, which means that now members of Microlight Institute get all of them included in their membership. And I'm going to be posting all of these recordings as they come in on the Institute in the knowledge base. And quite a few people have been joining lately, so it's becoming a really great community. So anyway, next week, September 9th, Jane Mann is going to be teaching with me, and she's also teaching with me on the 30th. Now, Jane Mann is a very advanced esthetician who lives in Las Vegas, And she has quite a big following. She has a Facebook group that's yet by invitation only. It's called Microcurrent for Facial Rejuvenation. And she has a huge following of estheticians all over the country that just love her and just follow everything she says because she has knowledge that hardly anyone has been sharing. And so anytime that she's come and taught with me, we've always had a big response. I already have a lot of people signing up for the September 9th one. So it's called How to Wow Your Aesthetic Clients with Myofascial Techniques. And so if you're a member of the Microlight Institute, it's included in your membership. If you're not, you can join it for $35. And it's about things like various forms of massage and trigger point work and myofascial techniques that borders on Tui Na that you can do on the face in conjunction with microcurrent to give a more beneficial and superior lift, longer lasting lift. So that's going to be going over that September 9th. And then, as you can see, Jane will be back on the 30th for another webinar called Vibrational Enhancements for Facial Rejuvenation. And that will be information about using frequencies, using color, using acupuncture points, sometimes possibly other types of vibrational things like essential oils. In other words, she has a huge amount of experience, and then she and I put all our experience together to teach these webinars. So that'll be also the second one in the series. And then the 16th, which will be 2 weeks from today, I'm teaching one on patient compliance. This is a huge issue. I mean, whenever we have our mastermind groups, people talk about their angst about patient compliance, like people actually complying with coming back as many times as they need, or complying with taking their herbs, or changing their diet, or lifestyle things they need to do to gain their health goals. I've learned quite a bit about how to work with clients, the psychology of it, and how to get much higher patient compliance. So I'm going to share that on the 16th. And again, it's included. Actually, this is not correct. It's not $35. It's $20 for non-members on that one. But it is included for Microlight Institute members. And then the 23rd, we will have our mastermind group that happens once a month, which I definitely recommend you take advantage of. So difficult pain cases seems to be what part of my mission in life is to help with my own cases that are very difficult, and then with other people to help them get better results with these. What is a difficult case? It basically means somebody that's not responding well to the things that you are doing, that you're skilled and trained to do. And you use your best skills at diagnosis, you use the acupuncture or massage or chiropractic or whatever you do that you know to work. And these patients just have paradoxical results. They don't respond well, or they do, and then they get aggravated easily, or pain just comes back very quickly. It's just not happy for them or for you. I've really devoted myself for decades now, mainly because I needed it for my own practice, to how can I crack the code of these really difficult patients? Like, what can I do differently? Because what I learned in school, my acupuncture school, really was great in some ways, but it didn't actually prepare me to treat these difficult pain patients. I had to learn it on my own. And when I started to use microcurrent, that was a big breakthrough. And I got results with difficult pain patients I had not had just with needles. But then even that, I had to really refine the techniques beyond the more common microcurrent techniques. That's what you're going to learn about today. So pain can be a complex phenomenon. It's often associated with the aftermath of physical trauma, emotional pain, poor posture, people that have repetitive work injuries, lifestyle issues, and past karmic reactions. Yes, a lot of chronic pain is due to karma, but we won't go into that on today's webinar. But it's very difficult to reason out in advance what will help most patients. So what I have found works the best is a flexible inductive system where you don't have to know in advance what's going to help them the most. You don't have to figure it out in your head. You just take it one step at a time and follow the sequence procedure that I'm going to teach you here today, and you will find that the good results just fall out. You find it almost by process of elimination, and it moves really, really quickly, which is nice about this. So pain mastery sequence therapy uses a series of brief probe and pad techniques. probes are the wands that we treat acupuncture points with in pads or the patch electrodes. Then you retest the patient's pain-free range of motion after each step. This is the key to this system, is that you do a very brief technique and then you retest to see what improvement the patient has. Now, how do you retest? Let me explain that first. It's very, very simple. When a patient has pain, there's usually some type of movement that is difficult for them. So it could be bending over, it could be walking, it could be going up or down steps, it could be twisting their head to the right, it could be putting their shoulders straight up or putting their arm behind their back, twisting their ankle, whatever it is, you have to find out, which is very, very easy to do because they certainly know about their pain, which movement will aggravate their pain. And that becomes your test. So then you do your first technique in the sequence. And that technique could be as short as like 20, 30 seconds, 1 minute. I mean, these are very, very fast-acting techniques. And then you have them do the test. So if it's raising their arm, when they first start, they can only get about this far. Then you do technique number 1, circling the dragon. Then, okay, raise your arm again. And they say, okay, now I can go up to here. So and sometimes it'll change and sometimes it won't, but you just notice that after each technique. You need to combine root and branch therapies. Root and branch therapies, I'm going to explain a little bit later, but this is a huge key to success because most practitioners are treating mainly symptomatic issues. And they're not necessarily addressing the root well enough. And because of that, the results either aren't complete enough or not long-lasting enough. The responses are often far better than with traditional Chinese medicine or conventional electrotherapy. Yeah, I mean, I've been an acupuncturist for 33 years, 33 and a third perhaps, very close. And I know the power of acupuncture. I also know some of the limitations of acupuncture. And I really found that microcurrent will take it a lot further than just the basic acupuncture will. Yet, having said that, there's ways of combining acupuncture with microcurrent that are just off the chart of effectiveness, and I will talk about that today as well. Now, pain mastery sequence therapy works great with the microlight therapies that I teach. You can also use it with any set of techniques you work with. It could be bodywork techniques, it could be chiropractic techniques, it could be needle acupuncture techniques. The main thing is that you do them in a sequence and you have a way to test them after each technique. So here's the suggested pain sequence. What I suggest is that you start with the root treatment. Now, many of you have heard me say this many times, and I hope you're actually trying this out. But the root treatment means a treatment that balances the person on a systemic level, on an organ level, on the level of the 8 extra meridians, or the chakras. But any one of those could be considered a root treatment. And there's other root treatments as well. Now, if you use tuning forks, some of them are considered more symptomatic and some are more root. It's the case of any treatment you're working with. So start with the root treatment. So it seems counterintuitive because the person's there saying, Doc, my lower back is just really killing me. What are you going to do? And then instead of doing anything for your back, you start balancing their liver and their kidneys, and they go, what the heck are you doing? What about my back? And I always have to explain to them, before your back's going to respond as well as possible, I first need to get your overall body energies in line. So that's called the root treatment. And I've mentioned this in other classes that Dr. Hartfeld Schultz from Germany, quoted in my book, Microcurrent Electro-Acupuncture, was able to prove that there's lines of condensation of force that come off each of our organs. I don't know if any of you have heard of heart math, but that's a system that's based on the power of the heart and regulating your moods through, regulating your moods through checking your heartbeat and the energy field. And that's based on the fact that there's a huge energy field that comes off from the heart that actually extends way out from our body and affects people around us. That's what heart math teaches. Well, that's also true of all the other organs as well, according to Dr. Schultz, that each organ has this huge field. So when you have myofascial pain, lower back pain, knee pain, migraines, it's actually the radiation from the organs that is largely responsible for that. Yes, of course, we have physical injuries to our joints and so on, but the chronic pain aspect has a lot to do with the organs. Therefore, balancing the organs first with Mu-Shu technique, PNE balancing, which is my chakra healing technique, 8 extra vessels, or other methods you may know, is going to help you to get much better results when you actually start working directly on that low back or knee or whatever it is. So then after you do the root treatment, which could be, I do my root treatments in about 2 minutes, 3 minutes. I mean, it goes really, really fast. And I can teach you to do that too. Circling the dragon is the first technique of the sequence. That's a localized treatment for local pain. And then the polarized local distal treatment. There are several variations which we'll go over this morning. And then I love this auricular micro-macro technique where you connect a body point that's painful to an auricular point that corresponds to that body point. And you use a special polarized circuit. Then you get to the realm of pad electrodes. These first 4 are all using the probes, which treat acupuncture points on the body or trigger points on the body. The pad techniques are much more systemic. You can place pad or patch electrodes to surround the whole lower back or the whole shoulder girdle or to cover all the legs. And one of the most powerful systems for that is called frequency sequence therapy, where you run a series of microcurrent frequencies. We'll talk more about that as well. Another option is interferential therapy, which is a mixed frequency heterodyning pattern, which is automatically set up in an Acutron. I mean, all these treatments are just automated in the Acutron, so you don't have to really go into the detail of being highly technical to use them, to make it easy for you. So root refers in this type of clinical setting to techniques that treat the underlying weakness or toxicity of the organs, the endocrine system, and then what's often referred to as the 3 treasures of qi, jing, and shen. Now, according to traditional Chinese philosophy and medicine, if you have abundant qi, which is vital energy, jing, which is the power of the body and the sexual essence, and then shen, which is the light of spirit and consciousness, you're a happy camper. You know, your life is fulfilling when you have that kind of good levels of qi, jing, and shen. And you're also, if you get sick, you're going to tend to get better more quickly. You're going to tend to not get sick. In other words, this is what people are lacking who have chronic pain or chronic depression, who are burned out, or all these types of things. And of course, when your qi, jing, and shen is exhausted, you go bye-bye out of this body. So anything that really balances or enhances qi, jing, and shen, or balances the organs, balances the emotions, balances the hormones, this would be considered root treatments. Now, branch treatments are ones that directly address pain or neurological weakness, imbalance, or dysfunction. This is really what the patient comes and asks you for. They don't come to you necessarily and say, please balance my root energies. They don't necessarily know to do that. They're going to say, my shoulder's killing me. I need to stop smoking. These migraines are coming on every 7 days, or that. That's what gets the patient's attention. So you have to have the wisdom as a practitioner to go to the root first, and then know skillfully what to do to actually directly help their symptoms. That's the art of medicine. Now, I would certainly say it's best to combine both root and branch techniques into your pain sequence for best results. And all the mentors that really inspired me and taught me in my practices all did that. They all came to their own system of combining root and branch in their clinical treatments. Now let's talk a little bit about needle acupuncture and non-needle acupuncture. Now the advantage of needle acupuncture is that it's better for directing qi. Like if you put a needle in the body and rotate it and manipulate it, you can really get that coursing sensation of qi, the dead qi phenomenon, more strongly than I think happens with microcurrent. And sometimes that's really good just for breaking up energetic blockages. With needles, you can treat many points at once. You can just put needles on various distal and local points and have the patient just relax on the table. And it's very relaxing, and there's a lot of benefit to that. There's a lot of biochemicals that are released in the body when someone's receiving acupuncture. And so I call it the chill pill factor. It means that there's a lot of endorphins released, and it's kind of sort of blissful receiving acupuncture when it's done skillfully. Also, acupuncture is needed for some of the conditions. Even if no matter how much I love microcurrent, There's some conditions where I just need my needles to get the best result. Things like, I use it pretty much with migraines, with peripheral neuropathy, with severe low back pain. I like to combine the needles with the microcurrent. And then one of the needle techniques is called bleeding therapy. Not that many acupuncturists use it in the United States, but there's some conditions that doesn't matter what you do with regular acupuncture or microcurrent, they're just not going to get better till you let some blood out of some of their veins where there's the purplish kind of vein. So that is needed sometimes when other things don't work, stagnant blood. Now, but here's the advantages of using the non-needle acupuncture techniques. I call it microlight electro-acupuncture. You see, these are the places where it's actually, I feel, is superior to needles. Is that when I feel like I just see faster and more impressive results with pain relief with microcurrent than I did when I only used needles. Facial rejuvenation, the lifting and toning effects is better with microcurrent than it is just with needles, and plus there's not the chance of bruising somebody and leaving shiners on their face. Of course, because we're using microcurrent, which is an electrical current, it clears the electrical blockages more directly than needles because you could use specific frequencies, you could use specific polarities. And then with these neurological issues, stroke rehab, whatever you would do for that with acupuncture, the microlight, the frequencies greatly accelerate the results for people with peripheral neuropathy and post-stroke, multiple sclerosis, and issues like that. With the Acutron system, you have the power of choosing polarized probes so that you can actually drive the energy in a certain direction with positive and negative. You have the power of using the frequency sequences, which you can't do any of this with needles. And then you also have the power of color, because we also have the color probe that you could choose any one of the 12 colors that specifically targets that patient's emotional imbalances, what hormones they need to have balanced. It also helps the pain relief. It helps the lifting of the face and all these other things. So these are things none of these you can get with needles. And again, I mentioned this for degenerative neuromuscular diseases. Using the series of frequencies is very powerful. Also on a business level, there's a lot of people that just won't come to acupuncturists. They're just scared. They're chicken. Bark! But if you tell them that you're doing non-needle techniques, a lot of them will be much more comfortable coming to you. It's also much more effective and appropriate for children. Young children don't really like to be needled. It's very hard to do. It's traumatic for them. Just use this non-needle. It works great. And using some of the new business offerings you could do with this kind of therapy, like facial rejuvenation, the ideal weight program, PNE balancing, you can definitely increase your income significantly. And so many people are doing that. And one of the things we're teaching in the Microlight Institute is a lot of business support to help you get the really specific information. It's easy for me to sit here and say, yeah, you could boost your income by several $1,000s a month. We'll actually give you the know-how how to do that through some of the courses that are posted there now and that will continue to be offered. So conclusion, it's best to combine both therapies for treatment mastery, needles and microcurrent if you're an acupuncturist. Now, if you can't use needles clinically, if you're not licensed to do that, you can do a very complete treatment, all non-needle. It also definitely is possible. So here's some examples of combining needle and microcurrent therapy. The general thing that I do is that I use way less needles. I don't use a lot of needles in my practice, very few in most cases. But I just choose mainly distal points or 8 extra vessel master points and sometimes a few Acu-Points. And then I let the non-needle technique do most of the work. So for instance, severe back pain and sciatica. I think most of us deal with that. There's the Ling-Ku combination on the hand, which is 3 points on the back of the hand, which have been taught by Dr. Richard Tan. And also you may want to use some distal points on the legs or feet. But I don't actually put needles in the area of pain on the body. I pretty much just use microlight therapy, using the pads or the probes. And that is very, very effective, combining needles and microcurrent that way. Peripheral neuropathy, something that I've had a lot of success with. And that's where you would use some needles to deep needle the points on the sacrum called the Acu-Points, Bashi-Points that are on the hands or feet as is appropriate. And then let polarized microcurrent pads along the area where they have the neuropathy, and then run series of specific frequencies that tend to reduce neuropathy. And again, we have all these protocols on the Microlight Institute. So you can look any of this stuff up 24/7, whenever you want. You can go there and you can just look under the subject matter you want. And so there's videos, articles, and protocols. So I'm so glad to have that up now. So things like internal diseases, it's not just all about pain. Say somebody has stomach ulcers or kidney imbalances. Well, you can needle the source points or some of the special points that are for that organ, and then use the Microlight Mu-Shu technique to balance the organ. I also use spinal autonomic balancing. So these are all very specialized techniques that I have been teaching for many years, and they continue to evolve. Now, if any of you have been using those techniques, I'd love to hear from you. Have you post on the raised hand symbol and let us know how it's been working for you. Now, microlight therapy uses high frequency in the form of light and low frequency in the form of microcurrent. And that high-low combination seems to shake and bake the body in such a way that it releases pain very, very efficiently and also addresses the root. Here's a picture of the Acutron system. And I'll show you also a picture of the new module in a moment. So now we're going to actually go through these techniques. Now again, for a lot of you, this is a review. You're already doing a lot of this stuff. But I tend to believe, like I said, that you'll pick up something that maybe you were missing along the way. So the Mu-Shu technique, this is what I was talking about earlier, is that you're choosing alarm points or Mu points on the front of the body that correspond to the organ that you want to treat. Now, how do you select the organ to treat? Well, you have to have your diagnostic skills. We're all taught that in our own way. In acupuncture schools, they teach you pulse diagnosis, or abdominal palpation, looking at the tongue. Other people use kinesiology or Western lab tests. Any of those are good. What I personally like to do is a combination of Chinese pulse diagnosis and kinesiology, muscle testing, where the person touches the alarm point and I test them and test the colors, and that's really a wonderful system. Well, however you arrive at it, let's say someone has lower back pain, and then you test their organs and you find out that their kidneys and their triple warmer is imbalanced. So then you could do the Mu-Shu technique on the kidneys and the triple warmer. You choose polarized probes, probe number 2, put the positive on the kidney Mu point, which the one I use is next to the belly button. It's called kidney 16. And then the negative would go on the back Shu point, which is, see, on this chart would be bladder 23 right here. And I'm using magenta color here because magenta is one of the colors great for the kidneys. So you're going from the front with positive, negative on the back, and you do it bilaterally. The whole technique, testing the points, treating, and retesting at the end, can be done in 5 minutes. It's just a matter of learning it. And you get such a boost to all the results or anything you do after that because you address the root. Now let's get into the actual pain relief techniques. We can call these the branch techniques. So here's an example. You have 2 of the probes and you simply circle the dragon. In other words, you treat points around the painful area. So this woman has shoulder pain. So I'm treating some points here above and below the shoulder, from the armpit to the top of the shoulder. You could also go from the front to the back of the shoulder. And the Acutron and other really good microcurrent devices allow you to do what's called searching. That before you press the button to actually start the treatment current, you move the probes around and listen to the sound that the machine puts out. And it'll go something like that. When it goes to those higher pitched sounds, it means you're over open acupuncture points. So it locates the points for you to treat. They may not be official acupuncture points out of the books. Doesn't matter. Wherever the machine guides you, just use those. And that makes it very simple and easy for you. And so once you search and find the correct points, then you look at the reading on the meter. And let's say, for instance, the initial reading was 35%. That would mean that there's 35% of the possible conductivity there could be and 65% blockage or resistance. So what happens is as you treat with microcurrent, that blockage and resistance goes down and the conductivity goes up. and the circulation increases, the qi and blood move better, and a lot of other things happen that create a cascade of reactions to relieve the pain. So then you treat for 6 seconds, let's say from this point to this point. At the end of the 6 seconds, you'll see the reading on the meter usually changes. It usually goes up, which means that some of that blockage was taken away. And you just keep treating in 6-second increments till the reading stabilizes. Usually, any one set of points is a total of about 20 seconds towards stabilize. It's all you need. You don't need any more than that. The 20-second miracle. Now, move on from circling the dragon is a very easy technique. It's usually the first thing people do when they get equipment like this because it's so simple to understand, and you get quite a lot of really interesting results from it. Even though the results are good with circling the dragon, don't stop there. Make sure you go on and do these other techniques in the sequence so the results can be deeper and longer lasting. So the second step would be various polarized probe techniques. Now, the way you do that is on an Acutron, you would choose probe preset number 2, which says polarized probe negative dermatome distal. That means that the probe with the actual trigger button on it will be negative, and the other probe that does not have a trigger button will be positive. Very important to know that. So you can see all the things here that this is really good for. Let's go over some of the polarized probe techniques. This is the way the normal polarities in the body work. The midline of the body tends to be electropositive. The extremities tend to be electronegative. Now, these can be reversed in people with some very severe chronic pain and neuropathy issues, but this is the way normal people are polarized. So, some of the techniques will be using the probes to follow this normal polarity. So if someone's having a headache, that means too much yang energy up here in the head. You would put the positive probe on the head because it says positive here, right? And the negative probe on maybe a distal acupuncture point on their foot or around their wrist, whatever is associated with that area of headache. And what you're literally doing is pulling that excess energy away from the head down to that distal point. And the headache goes away. It's magic. It works. If somebody has pain in the lower back, you could put the positive on the lower back, and the negative may be on bladder 40, Wei Chung, or kidney 3, Tai Chi, maybe the Ling Ku combination on the hand, whatever is called for. And again, the positive is pulling that pain energy away from that area and then strengthening and stimulating the distal points. And that's a very powerful way to relieve pain. So that's what these polarized techniques basically do. So there's several variations on them. This one follows that more simply, is that the positive is closer to the midline, because remember, the midline is more positive. You see, the whole midline of the body is more positively charged. So you put a positive closer to the midline and the negative more distal down the arm or leg. So that would be, let's say, one of the polarized techniques. Now another one is very different than that, is where you just put the positive on a point of pain and the negative on an opposite joint. This is really powerful. We call this the great loops. So this one is not so much following that diagram I showed you as much. It's really a technique in its own right. And this for on the extremities, positive on the pain, negative, you palpate for a point on the opposite quadrant. Let's see. So let's talk about some examples. Let's say, for instance, the person had wrist pain, left wrist pain. So you could put the positive probe on the Ashi point that hurts on their wrist, and then the negative, this is left wrist, and then you could go down to the right ankle, which is the opposite corresponding joint to the left wrist, palpate around there. If you find any tender points, put your negative probe there. And then that, again, that balances the wrist and ankle and will relieve the pain in the wrist, or at least do a certain portion of that pain relief. Now, not each technique is going to work. When you're going through sequence therapy, some techniques are really effective and some don't do anything. But that's exactly the whole point of this. You find out which techniques will be effective as you go through the sequence. So it's a process of discovery. And I really like that in relation to acupuncture and energetic medicine, that it's a process of discovery. It's like each patient comes in is like a a mystery, is a puzzle. They're coming in with these issues that they haven't been able to get help with, that haven't healed on their own. They maybe have tried other doctors and other practitioners, and they haven't had really satisfactory results. And so here's this person in front of you, and you need to discover what's going to work for them. And I find just thinking about it with my intellectual brain and knowing what skills and training I've had isn't enough. It certainly helps. It gets me into the ballpark, but as far as hitting a home run in that ballpark, I need to actually go through the sequence and just experiment a little bit and actually look at their real life responses. And that's how I find out what's going to work. I'd love to hear from you. If you have any questions or comments or discussion about what I'm saying, please click the raise hand symbol and share here. This would be very, very helpful. Now, another technique which I just love is called auricular micro-macro. This treats points of the ear, and I think auricular therapy is well known to most of you, with a negatively charged tiny little metal probe, and then the positive probe goes on the point of on the body where the pain is. So in this case, this patient has pain in the right knee. So Dr. Terry is holding a positive probe on her right knee, and then she's putting this little metal tip on the negative probe on the point in the ear that's called the knee point of the ear. There's a point in the ear in the triangular fossa that's considered to correspond to the knee in auricular therapy system. It's the microsystem of the ear. So the macro would be the knee itself, and the micro would be that little point in the ear. So that's why it's called micro-macro technique. And this is amazingly powerful. I've had so many breakthrough results with difficult, challenging pain issues just from this one technique alone. But that doesn't mean you should only do this technique. Try the whole sequence to get the best overall result. Here's examples of the microsystems. You have the ear, which has the whole map of the body. And like I said, the knee joint, you can see the knee joint here, which is a little bit in front of the triangular fossa. The area of the sciatica, the buttocks is right here. Here's the uterus. So there's points in the ear that correspond to every part of the body you'd want to treat. So again, you put the positive probe on the actual body part and the negative probe on this corresponding ear point. You could do the same thing with the Korean hand points as well. So auricular micro-macro, here's a couple of examples. Positive with blue light on the lower back, negative on the low back point of the ear. I already talked about wrist pain. Positive on the wrist, negative in the wrist point of the ear. So as an example, in the sequence I mentioned earlier that you could put positive on the wrist and negative on the opposite ankle. That would be another step in the sequence, the great loop technique. Then you have them test and move their wrist and see how it's feeling. And if it's totally perfectly healed, maybe you just want to stop right there. But if there's still, let's say it's about 80% better, there's still a little catch right here, then go to the next technique, which could be this one, positive on the wrist, negative in the wrist point of the ear. Here's a lot more pictures of that great loops technique I was telling you about, the wrist and the ankle, the elbow and the knee, shoulder and the hip. Meanwhile, I'm going to take a look at any other questions that are here. Okay, somebody asked how to become a Microlight member. I'm going to show you at the end the URL. You simply just go to microlightinstitute.com and click the membership button to join. And you're also welcome to email me with any other questions about that. Karen is saying, I've used light therapy only on 2 dogs with hip issues. I use a pendulum to determine which colors are appropriate, and 1 to 2 minutes of light is all that's needed. Oh, Karen, thank you for sharing that. yeah, that's really great treating animals with this. I've had a lot of good results with that also. But that's great about using your pendulum to test the color. Max just said there's no sound. Everyone else seems to be hearing the sound, so you might want to check your own settings on your computer then or restart the webinar. Sandra, if you have a tear in the shoulder, what would you add to heal that tear? Okay, good question. When there's actually a physical lesion like a tear, then you're probably not going to have them do as much of the motion initially, unless you can do it without pain. Generally, the pad electrodes to promote the healing and regeneration of that tear would be good. And of course, you want to make sure that maybe a butterfly bandage or something to hold that area together so it's in a good position. But I would probably focus a little more on, the 4 pads around the shoulder and then using sequences of frequencies that would target those fascial tissues and the muscles. But also the pain of the tear, you can certainly follow these techniques I'm doing here. Maxine said, how does Bell's palsy fit into this protocol? Well, this is mainly a pain relief technique, so Bell's palsy is not really about pain. But let's say if you're thinking, what sequence could you use for Bell's palsy? Yes, there's going to be a sequence for that too. What I would do for Bell's palsy is to start with the root. In other words, diagnose what their organ imbalances are, what their chakra imbalances are. Because remember, all the organs and all the chakras are reflected on the face. So when you balance the chakras and organs, it's going to help you treat that Bell's palsy more effectively, help people to respond to your treatment. So I'd first do the overall balancing, the root treatment. And then with Bell's palsy, I would work a lot with frequencies. There's specific frequencies that work on tightening muscles, and there's colors that work on that. Like green is very, very good for that. And there's also ones that really relieve congestion. And so I choose certain frequencies. I'd work with the probes. And it's very similar to facial rejuvenation. You're doing a lot of the similar moves that you would with energy light rejuvenation with the probes for Bell's palsy. There's certain pinching techniques, and there's treating origins, insertions of muscles. And you basically just spend a lot of time working those muscles with the microcurrent probe set to the correct frequency and the correct color, and then also do some distal points as well. And people have had really good responses for Bell's palsy using the Acutron. So again, Maxine, I suggest if you have some specific cases, go into the Microlight Institute since you're a member and post on the forum a case that you have about that, and then we can enter into some discussion and get other people's input on it. That's the fun part of having the Institute now. We can do that. Okay, well, that's all the questions for now, so let's move ahead with the rest of these techniques. So again, for Great Loops technique, the one I was just showing you, you use polarized probes, place the positive probe on the painful extremity point, and negative probe on the opposite quadrant, reflex points. Now, another step in the sequence that I use all the time when there's any kind of back or hip pain is reverse body image. This is a technique which also uses polarized probes where you put the positive probe on the painful spots on their lower back. And you can do this with several different spots. And I generally just ask the patient to hold the probe for me. They hold the positive on that area, and I put the negative on these reverse image points. Makes my job easier. So basically, you have these points which are right underneath the clavicle. So if you palpate from kidney 27, which is underneath the middle of the clavicle, from one side to the other, between the two kidney 27s, you basically just look for, you're palpating along like this, that's where it is. They're gonna, if they have lower back pain, you're likely going to find some really tender point in that area. So that's where you put your negative probe. And again, you can choose several tender points up here, and you can choose several lower back points. But the main thing is the positive needs to go in the lower back and the negative needs to go on the upper chest. And you're literally working on the holographic layout of the body, as above, so below. For hip pain, the reverse body image points are a little lower in the second intercostal space. And then there's some reverse body image points on the abdomen as well. So this is another really great step in the sequence, and many times there's a real breakthrough effect with severe lower back pain and sciatica using this technique. Now let's get into the pad techniques. Those are all probe techniques where you're holding the wands and you're treating specific points. As you can see, pad techniques are treating much broader areas of the body. So you can have it just be stationary, put them there and they just sit with them, or lay down at a table. But what I like even better is having the patient do active motion while the pads are doing their work. It seems much more dynamic and much better for readjusting the fascia and the muscles and releasing the pain and stretching the scar tissues and whatever else that is able to do. All the wonderful benefits of exercise. And so there's several styles, which I'm going to go into, of what kind of current you'd actually apply through the pads. Now, I guess a little later after the shoulder pain explanation tells you more about the pad electrodes, so we'll be coming back to that in a moment. But let me just say for now that frequency sequence therapy is something where you just run a series of different microcurrent frequencies through your pads. And you always use two sets of pads. So you have one set, which is for the tissue type, and another set of pads, which is for the condition. I'll explain more about that in a little bit. That's one way of treating, which is really wonderful. The other is called interferential, which is more of a pre-programmed treatment in the Acutron or other devices that also uses mixed frequencies, but it's much more fixed. You don't have the kind of flexibility you have with frequency sequence therapy. But both are very powerful for treating different areas of the body with pads. So to give an example of pain mastery sequence therapy, let's go over shoulder pain. So basic steps would be starting with circling the dragon after you do your root treatment. This is localized treatment on the shoulder, treating various sets of points. You could use the great loops, which I'll show you in some pictures, positive on the shoulder and negative on tender points on the opposite buttock area. So if you're dealing with left shoulder pain, then that negative probe will go on the right hip area, right buttock area. Auricular micro-macro, which I showed you a picture of already. And then use your pads to do electro-massage of the shoulder, which is wonderful for the shoulder joint. So step one, circling the dragon. You choose biphasic probes, which means back and forth polarity, to treat 2 to 4 sets of painful or open points around the shoulder, bracketing the area of pain. Now, what it says here may be combined with shoulder positioning. That's very interesting. What I often like to do is find out what position is the furthest the patient could go in their range of motion before they hit the painful or restricted range of motion, and have them actually intentionally hold their shoulder in that uncomfortable position while I am treating them. I find that the releases of the shoulder are much stronger when they're in a stress position like that than if their shoulder is just relaxed. Another thing you can do is you can actually do electro-massage where you take your thumb and really push on a really painful trigger point, and then while you're holding that trigger point, move their shoulder through a range of motion. And you can combine that with breath work. And that's also, there's a lot of release from that too. That works very well for the shoulder joint. Step 2, the great loops. I showed this earlier. You can put the positive probe on the painful shoulder point. You go to the opposite buttocks and you palpate. Don't just choose any random point. You have to palpate to find the tender Acu-Point and then put the negative probe there. Very, very good technique. Here's again the auricular micro-macro we went over earlier, positive on the shoulder, negative in the shoulder point of the ear. And I always am using color therapy with it. I mean, this picture was taken, I guess, with probes that don't have the color, but all our probes now have color in them. So you could choose a color like blue or green or colors that specifically reduce inflammation and improve the muscles and whatever the specific presentation is. And here's a picture of the area of the ear that has the shoulder projection in it, the hologram of the shoulder. Now, the final step of treating shoulder pain would be the pads. You could put the pads on and use frequency sequence therapy or interferential. You can also have them do exercise while the pads are running, which I highly recommend. I think it makes the treatment a lot better. You can do electro-massage, like I mentioned earlier, where you actually can run the current through your own fingers. You do that by putting in each channel one pad on the patient's body and one on the back of one of your hands. Then when you touch them and massage and move them, you actually are, your hands are the electrodes now, and you can actually feel the different tissues just melting under your hands. It's just really wonderful. You can feel the changes, and you can also use friction massage when there's adhesions. You could use different types of twee-knot techniques to release trigger points. Whatever you're skilled in doing, you can do enhanced by microcurrent, supercharging your therapy. Now, I mentioned I'd talk more about the pad techniques, and I'm just going to go through this quickly because we don't have time to do a complete seminar on pad techniques. But the pad preset number 1, microcurrent on the Acutron, you can run a series of frequencies. Now, with the base Acutron that was around until last year, you can do that, but you have to keep changing the frequencies manually. Like you have to keep going in and changing every 2 or 3 minutes. The new FST module that we're now offering, that's been out for just about a year now, does all that automatically. So that's a thing of beauty. People are loving those. I'm going to show you a picture of that in a moment. The FST module is an enhancement that can go on your Acutron to allow you to do all these extra techniques, and a tremendous amount of training and education put into it too. Another Acutron pad technique I use a lot is microcurrent interferential. And that is a more fixed technique where you actually have 2 different frequencies preset, and you cluster 4 pads around the area and then have them do the moving and exercise like I showed you earlier. There's also interferential number 5, which combines milliamp, which is high level intense current, with microamp, which is very low current. And that is good when you have more acute conditions, things like disc issues of the lower back or severe hip pain. There's also called Russian stimulation that I use a lot with my post-stroke patients and peripheral neuropathy patients. And then you have for wound healing this other one called Microcurrent Pad number 3. It's actually number 2. So you don't have to learn all these right away, but there is quite a lot of different treatments that you can learn to do for these different conditions with the pads. Probably the ones I use the most are just the FST and the interferential. Those are the ones I'm using the most commonly in my practice. Now here's a picture of the module for those of you that are not familiar with it. As you see, it's a tablet computer that we mount onto the Acutron, and it brings up its own user interface. And you can do all the same things you could do with the Acutron previously, but then in addition to that, you can go in and have hundreds of frequency sequences memorized, and you can create as many more as you want. You can modify them, and it makes this sort of the ultimate FST device in the world because no other device can do all that. And then what you see here is guided treatment protocols. That's another new feature of the tablet, where it actually has videos on the tablet itself that actually teach you how to use how to treat patients, how to actually treat these difficult conditions. Like for instance, for facial rejuvenation, the system of energy light rejuvenation. It's all programmed into the tablet, so you don't even need an instruction manual. You can just let it teach you as you go along with little videos. Same thing for peripheral neuropathy and other kinds of conditions. They're just there educationally on the tablet. So this is some huge advances, and people are really, really enjoying having that. I mentioned earlier I would share some frequencies with you, so here's some frequencies that are very good for shoulder pain. For those of you not familiar with FST or FSM, these are cycles per second, the amount of pulses per second, and each of these frequencies is like information for the body. It actually resonates with a certain either condition that the body could have, like inflammation or congestion, or it can resonate with a specific tissue type like bone, ligaments, fascia, muscles. So instead of just using one frequency, people have found that a series of frequencies, a sequence of frequencies works the best, say over, say, a 10 to 40-minute period, depending on what you're dealing with. Most of the treatments I do are keep it to about 10 minutes. So again, there's a great deal of information about this on the Institute if you want to study into the frequencies further. And then color. That's a whole huge science of how we choose the colors. Now this is much easier. There only are 12 colors we're working with, so it's not that much to learn. But for instance, acute pain, some of the best color testing I've seen has been with purple. Joint issues tends to be treated best by green. Neuromuscular could be a lot of things, but green, yellow, and lemon color seem to be some of the best ones for that. And then relaxing the solar plexus is done with the frequency of 200 hertz. It's also done with the color frequency of violet. So for instance, if you put 200 hertz into your probes, that frequency, polarized probes, and then use violet light to do a Mu-Shu on the solar plexus, that's very powerful for relaxing and calming stress and calming anxiety and many other things associated with the solar plexus. When there's deficiency in the organs, you can use red. And then scarlet and magenta target emotionally based pain and balancing the aura. And then blue is kind of like this jack of all trades. You could use it for any kind of pain relief, reducing inflammation, stimulating the pineal gland, and a lot of other things like that. So again, plenty of information about this on the Institute for your further study. So that ends my presentation. If you want to join the Microlight Institute, go to www.microlightinstitute.com and just click the membership link at the top and it'll guide you through. There's two ways you can join now. You can join for free as a free access. You don't really get all these benefits I was telling you about. All that does is it puts you on the mailing list so you're notified of webinars. It also allows you to get the Microlight Journal. So that's the only things you get if you do the free access. When you join as a paid member, which is right now $49 a month, very reasonable, you get huge benefits. You can go to the knowledge base 24 hours a day, 7 days a week, look up anything you want to know and see just hundreds of videos and articles and protocols that teach you how to do all these specific things I'm talking about, and we're adding more all the time. There's also courses you can take for CEUs. You can discuss things with your colleagues on the forum. You can also, there's opportunities to help market your practice through the Microlight Institute. And just a lot of things to do with personal practice, like developing your own meditation, your own Qigong. Like there's a lot of things. Now we're putting a whole series of videos on nutrition from a very advanced nutritionist that'll be going up in the next few weeks. So anyway, that's all the stuff that's there on the Microlight Institute. And the notes for this webinar will be posted there. And if you want to contact me directly, you can do that at my email, dstarwynn@eastwestmed.com. And here's a picture from the Microlight Institute, like all the different features of it. So the courses are offered here. Here's the knowledge base. Here's the forum, the Microlight Journal. We're setting up a shopping cart there and where you can purchase all the products that you might need. And then promoting your practice. So this more shows you what's in the Institute homepage. And then finally, if you're new to the Acutron and Microlight therapy, I'd suggest you go to this URL, eastwestseminars.com/getinfo, or you could just go to the eastwestseminars.com homepage and click the link that says request information. Either way will get you the same place. And then there's a lot of really good information you can immediately download there, and you can fill out the form and just say what kind of needs you have or set up a time to have a consult, whatever it is you'd like to do. I'll go back to this one, and then let's see if there's any other questions or comments before we close here today. Okay. Kay is asking, you said that patients could be switched with negative on the proximal and positive on the distal. How would the practitioner know that the patient is switched, and how would we treat the patient differently? I probably didn't explain what I was saying clearly because yes, what I was really saying is that, yes, it's true. The polarities can reverse. on some people with very difficult pain issues. And so when you probably find that out by the fact that they don't respond well to the normal polarities. You could also find that out by muscle testing. You could simply ask, is the polarities reversed, and do a muscle test. You could just have the patient touch their own painful area, take their other O-ring test on their hand. You could simply think in your mind, does this person need a polarity reversal treatment? Yes, no. There's some simple ways to do that. So the way you would treat them is still use the proper polarities to bring them back to that. So that would mean that if the person has, let's say, a reverse polarity condition on their right arm, you would still put your positive electrode up near the neck and your negative electrode down near the hand. So you're bringing them back to the normal polarity. It's like you're repolarizing that area. You also often need to balance the organs with Mu-Shu technique, because some of these polarity fields in the body come from the organs. So if there's a severe pathology in the organ, that could actually also lead to a polarity reversal. Balancing the chakras can help also. I hope that's helpful. Lynn said, could you show the frequencies again? Okay. There they are. Maxine said, thank you for always being here. Well, thank you for your appreciation. I really appreciate it, Maxine. It's my pleasure to serve you. So anyway, that finishes our webinar. I know one person here asked me to call her afterwards, which I'll do so. And the rest of you have a wonderful day, and hope to see you on the rest of our really great schedule this month of webinars. And also, please, if you're a member of the Microlight Institute, please come in and start participating in the forums. That's going to make it so much fun when we're all on there talking to each other about our cases and business issues we're having, and where's the best place to get ravioli or whatever else we need to talk about. So I welcome you to come and get involved on this new community. Okay, bye.